Hello, and thank you for joining today's webinar. We will be starting soon, but can you please share where you're joining us today in the chat while we wait for everybody to file in? Okay, well, hello, and thank you for joining today's webinar. This webinar is aligned with the type of content you'll find at Sigma's Creating Healthy Work Environments conference that goes from March 20th to 22nd in Washington, D.C. of this year. I'm going to place a link in the chat that goes to my apologies. I put a link in the chat that is to the registration page. And if you are interested in registering for this event. So today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. No one with the ability to control content has any relevant financial relationships. To receive contact hours for this NCPD session, participants are required to attend the webinar and log into our learning management system to complete an evaluation form. Information on how to access this will be emailed to all attendees 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, if we have time, we will have a question and answer session. You'll see on your Zoom webinar control panel that you can send a message through the Q&A feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so that the message makes it to us. Please use the Q&A for questions and the chat feature to interact with other participants. We would like to thank our speaker for sharing their expertise with us today. Of note, thoughts and views expressed are that of the presenter and do not necessarily reflect that of Sigma. Our speaker today is Adina Dacey. Adina Dacey is an associate director on ASHA's healthcare services team and has worked as a speech-language pathologist and sign language interpreter in healthcare and community-based programs. She currently leads ASHA's initiative to improve health outcomes for people with communication disabilities by advancing effective communication access in healthcare and public health settings. And now, Adina, please feel free to start whenever you're ready.
Great. Thanks for that introduction, Monica, and welcome everyone to Better Health Starts with Effective Communication, supporting access to quality care for people with communication disabilities. For many years, I've had the privilege of supporting people with communication, cognitive and swallowing difficulties across the lifespan and across different points along the healthcare continuum. And throughout this journey, I have to say I've probably worked more closely with nurses and CNAs than with any other group of healthcare professionals. So I'm really excited to be here, and I really appreciate you joining me today to discuss a topic that I'm deeply passionate about. And I think it's one that also sits at the heart of the nurse-patient relationship as well, and that is ensuring effective communication access as part of our patient-centered care. So thanks again for joining me today. So here's our learning objectives. Today, we're going to explore the intersection of nursing care, communication disabilities, and health equity through the lens of interprofessional education and collaborative practice. We'll look at how having a communication disability can make it harder for someone to manage their own health when information or environments like healthcare settings aren't easy to access, understand, or use. I'm going to take some time to help you identify ways to break down communication and environmental barriers so that everyone can access health information and quality care. And to guide us, I'm going to introduce ASHA, or the American Speech Language Hearing Association, which is where I work, I'll introduce our access framework, which has 6 key principles for improving patient-provider interactions when it comes to communication access in healthcare. And then before we kind of dive in the meat of everything, I do want to give a quick overview of what communication disabilities are in case you're not familiar with the breadth of them, and describe how audiologists and speech language pathologists like me can support effective communication in healthcare. And then finally, by the end of our time together, I hope you'll leave with some concrete ideas and action steps you can take back to your own settings to strengthen effective communication practices, both at your individual clinical level and maybe at the systems level too, which would be great. So together we can all support access to safe quality care for people with communication disabilities. And really the ultimate goal is to promote health equity for all. So I'd like to begin by sharing some big picture facts about why effective communication access in healthcare is so critical, why I'm so passionate about this topic, and why I hope you will become too. First, people with communication disabilities, we know from the research, have worse health and healthcare outcomes compared to people without communication disabilities. And second, we know that they frequently struggle to access the information and accommodations that they need for optimal health in those settings. So that lack of inclusive and effective communication access doesn't just cause frustrations for everyone, for us as providers as well as the patients, but it also contributes greatly to health and healthcare inequities. And some of the known disparities that we see, that I've seen personally in some of my patients, include higher rates of chronic conditions, avoiding or delays in seeking care, oftentimes because of frustrations they have with communication with their provider, definitely inadequate pain management, which some of you might have experienced with some of your patients, and increased healthcare utilization ultimately. And I think when communication access breaks down, the consequences can be really serious. Things we've seen like preventable medical errors, and even shortened life expectancy. So to me, this is a really serious issue. And finally, the third fact, and maybe you can identify with this, we know again from the research, but also anecdotally, I've heard from some of my colleagues that healthcare workers often report that they feel uncomfortable or unprepared to meet the communication and health needs of people with communication disabilities, which is understandable because you don't have the same training that I do, just like I don't have the same training you all do. And I think most health providers want to do better, but they often feel constrained by time and that lack of knowledge and available resources. So again, I thank you all for being here today to want to learn more. So, with those 3 facts in mind, I just wanted to pause for a minute and invite you to reflect on your own feelings about communication disabilities and healthcare access. I want you to think about your level of comfort in ensuring full access to health information and services for people with communication disabilities that have been in your care, or maybe that might be coming into your care that you just haven't even met yet. Um, and you can think about this to yourselves, or feel free if you want to share, any of these lettered responses in the chat. But it really is meant to be more of a self-reflection. But do you, A, feel pretty good about ensuring this access? B, do you know what you want to do, but you're not really comfortable or confident? C, I want to make sure this happens, but I don't know much about the topic or where to begin. Or D, maybe it's something you've never really thought that much about, communication or accessibility for this population. So I just thought that would be a nice way to level set kind of where we all are, prior to diving in. So again, just more of a self-reflection. So who makes up this patient population? Before we dive into all things communication access, which again will be the meat of today's conversation, I did want to take a moment to discuss who makes up this population of people with communication disabilities. Communication disabilities are most associated with individuals who have speech, language, voice, cognitive, or hearing difficulties. So we're not just talking about the deaf or hard of hearing patient that comes into your care. It's patients with a broad range of challenges with communicating. And not everyone with these challenges sees themselves as having a disability or a disorder. They might just consider it a difference. It's part of who they are. But by the laws and the systems designed to provide access tools and services, especially in healthcare settings, these patients often require a disability designation. So that's why you'll hear me use the term communication disabilities today. And unlike many physical disabilities, the challenges or differences listed on this slide and that most of my patients face, they might not be immediately visible to you or others. Communication disabilities can affect a wide range of functioning. So things like challenges listening, speaking, reading, writing, expressing their ideas, or even using one's voice clearly. They may not have the ability to use their voice at all. And then there's some related cognitive disabilities that also can go along with communication challenges. And those things may impact a person's ability to attend or their memory, reasoning, even the ability to use numbers, understand numbers, make decisions, and problem solve. And I think sometimes in our medical records, you may see a note that a patient is deaf or has a history of aphasia, one of the things you see, like this first item on the slide, or they have apraxia or dysarthria, or they're confused, or they might have an auditory processing disorder, or maybe that they stutter. Those things might be noted in the medical record, but often they are not. Or sometimes if they are, they're misnamed. Oftentimes I'll see in a medical chart, patient has dysarthria when it's really that they have aphasia. So as you can imagine, any of these difficulties you see here can make it harder to access health information and care, especially when the right communication strategies and accommodations or modifications to an environment aren't in place, which is often the case. And the communication disabilities I just referred to on the previous slide, those are usually associated with a range of developmental diagnoses and acquired medical conditions that you see here on this slide. So populations who may have developmental disabilities, those are listed on the left. And while those communication disabilities that result from acquired illness, injury, or aging even are on the right. So developmentally, you might see people with communication challenges if they have autism spectrum disorder, Down syndrome, if they were born deaf or hard of hearing, if they have intellectual disability, learning disabilities, and then some of the acquired things, which is the area I tended to more work in healthcare. Or you might see communication challenges in people after they have a stroke, or if they have a brain tumor, or they had surgery for head and neck cancer, if they have a tracheostomy or are ventilator dependent. So those are the kinds of patient populations that we're talking about, just to level set today. So you've already heard me use the term effective communication several times today, and we're only a few minutes in. But I want to take a minute to define what this means and what can make it challenging, particularly in healthcare settings. So again, if you have your own thoughts about how to answer these questions, you can put them in the chat, or just we can think about it at the end. It might make a nice little conversation towards the end, depending on how many questions and answers there are. But think as you go through in your own settings, what makes communication challenging and what has made it more effective for you, or how have you broken any communication barriers down that you've encountered? So I'm going to provide a definition that we're going to use in this context today. Effective communication is a basic human right protected by the Americans with Disabilities Act, or the ADA, and there's actually a definition for effective communication under the ADA. So in the context of our discussion, effective communication means that each person in an interaction has equal opportunity to share, receive, and understand information in ways that work best for them. And we're talking each person, so it's a two-way street, not just the patient, but you as well. And then also that each person has access to the resources that best meet and support their communication needs. And the resources might differ depending on the nature of your conversation, the length of it, the complexity, or the context. So, if someone's coming in and dropping off a form versus if they're coming in and sitting down to have a pretty serious or major discussion about a new diagnosis. So obviously to make effective communication happen, it takes a lot of teamwork. Communication is a two-way street. And for a long time now, like I shared, my patients who live with speech, language, voice, hearing, cognitive difficulties, all those things that we reviewed quickly on the previous slides, they've shared for a very long time their frustrations and needs around communication access in healthcare. And as an SLP, I've heard many of these perspectives firsthand. So I asked some of them what effective communication access meant to them or means to them. And here's what some of them told me. Um, and to them, it means if you, as a provider, ask them what helps. Ask me what helps, they say. So I'm going to kind of speak from their perspective. Talk to me, look at me, listen to me, all the things that we would like as patients ourselves. Tell me about my medicines. Wait till I put my hearing aid on or my glasses on before you show me how to do something or give me instructions. Use simpler words and easier forms for me to fill out. Just be patient. Give me more time. I want to understand what's going on and tell me if you don't understand. Those are some of the things that they would appreciate to help make communication more effective. And like I said, I think we all would. So, why aren't these things happening more consistently in our healthcare settings? I think there's many reasons why. So, I wanted to talk a little bit about some of the barriers, both from the patient and the provider side, that people face when trying to access health information and services. So, first, from the perspective of people with communication disabilities and their care partners. I wanted to note that the list of barriers on this slide comes again from my patients, but we've also at ASHA conducted focus groups with people who have communication disabilities, and there's also research that's been done on this topic. But the information here from my patients and from our focus groups at ASHA show that their experiences mirror what the research shows. And really, that one of the biggest barriers to effective communication in healthcare is time. Accessible, inclusive communication takes time. We all know that time is a commodity in our settings, but many patients say they feel rushed. And I think this is especially hard. Feeling rushed is especially hard for people who need more time to express themselves, or more time to read, or process spoken information, or to use assistive technologies that they use to help them communicate, or other accommodations like interpreters. Um, you know, they my patients have shared, or the people in the focus groups, that they're often interrupted or they feel excluded from conversations about their own care. So that lack of engagement really feels like an impact on their own decision making and their dignity sometimes, I think. They share that providers sometimes talk to care partners. I've seen this instead of them, which sometimes can lead to mistakes and confusion if the care partner doesn't know maybe as much about a medication that the person is taking as the person does. I think also they share that some healthcare professionals wrongly assume that they, as people with communication disabilities, are just generally unhealthy, or they're not competent, or they're less capable of doing things. Um, and that's not always the case. I think emotional factors such as fear and stress also play a role in communication barriers for some of my patients, especially during new diagnoses of communication difficulties or any big life changes or emergencies. And as you can imagine, unfamiliar medical jargon and complex language about health topics, those are barriers for everyone. They're barriers for me sometimes, but especially for people with communication disabilities when they don't have access to that information in accessible formats. So, as you can see, and I'm not even done with the list of barriers that they shared, there's a lot of work to do. Um, and that's kind of a lot at the individual level, but we also know that there's barriers at the system level. There's gaps, like inconsistent ways to even record their communication needs. They come in and they're like, we have to tell the same thing, that we tell the people the same thing in the medical office every time we need an accommodation, and they still don't have it for us. So because there's not a way for that to be recorded consistently in a medical record, we're starting to see that a little bit more. Epic has some capabilities to document disability and accommodations now. But there's lack of equipment, or sometimes they experience refusal to provide reasonable accommodations, or people want to charge them for it, which is not something that is to be done under the ADA. So all those things create barriers. And finally, I would say applying a one-size-fits-all model can be a barrier. Like universal design is great, or maybe you think, oh, I've used this communication tool with a different patient, so I'm going to try it with this one. But individualized support is still really important to ensure equitable and effective communication for all your patients. A one size fits all does not always work, although there are definitely some tools that we use consistently across patients. So those are the patient reported barriers to effective communication. And now we know that healthcare providers, staff, and systems, I'm sure these you will be able to identify with some of these, face some of the same, but also some unique barriers to providing effective communication. We also did focus groups with providers, and those in our focus group echoed that time is limited for sure. That seems to be the number one barrier. They also report they need more education and training about communication disabilities. So, again, I'm glad you're here today, and how to use different communication strategies. All of that is needed to make them feel more comfortable and more confident in their interactions. Um, they also mentioned that those policy and system level gaps, that they don't have great processes themselves for identifying patients maybe with pre-existing disabilities when they come in, and documenting that what those communication needs are. That's not happening consistently. I think also many healthcare workers aren't sure how to access accommodations in their settings or communication tools, or even involve specialists like audiologists or speech language pathologists. I recognize as nurses, not every setting that you're in will have an audiologist or speech language pathologist. We work in almost every setting that you're in. Not as much we do work in outpatient settings, probably not as much overlap with nursing, but we're definitely in acute care hospitals and skilled nursing facilities and home health and what am I missing? Inpatient rehabs, hospice. So we're in a lot of the same places you are. But I think, there's also the overwhelm of staffing and financial pressures and heavy workloads. And I think with all of these things, it's kind of easy to see why effective communication can fall through the cracks, even when people know it's important and we all want it to happen. So there's a lot of work to do, clearly, both at the individual and systems level, to break down the barriers to effective communication. And I don't expect to tackle it all in an hour. And I don't mean to overwhelm. I think if you can think of one bite-sized thing to take away, it can have a great ripple effect. But I wanted to talk a little bit about what we need to do to work together to make this happen, and how we can work collaboratively to reduce these barriers. So let's talk about how next. So, ASHA, again, where I work, the American Speech Language Hearing Association, we're the National Association of Speech Language Pathologists, Audiologists, Speech and Hearing Scientists, assistants, and students. And we work to support members as well as consumers with communication disabilities, and other related health professionals with resources and continuing education. And advocacy. And our longstanding vision at ASHA is to make effective communication a human right, accessible and achievable for all. So, supporting person-centered care that improves communication access and health outcomes for our patients is the core of what we do as audiologists and speech language pathologists. So, audiologists are my colleagues who work more in the area of hearing and balance and tinnitus as well. And as communication specialists, we're all uniquely positioned to equip nurses and other health professionals with the tools, skills, and systems you need to ensure that everyone in a health interaction can understand and be understood. So please use us as resources. And I want to talk a little bit about how we can collaborate today. So, with growing recognition of the need to make healthcare more accessible and equitable for everyone, I think the pandemic really highlighted some of that, especially for people with disabilities. We decided to launch a health-focused communication access initiative with the tagline Better Health Starts with Effective Communication. So that's where the title of this webinar comes from. We chose this tagline to emphasize the importance of prioritizing communication from the very beginning of any health interaction and to highlight the difference that can make in outcomes for patients, providers, facilities, and health systems. So I'll share, this is a great, well, I'm a little biased, but I think this is a great website with a lot of resources. You'll have access to this link from the slide deck. And I'll get into a few of the resources that we have a little bit later, but this is where our Communication Access Initiative lives. So one last definition for you, and that's communication access. How are we defining communication access for the purposes of this initiative and in healthcare? I think in healthcare, it really means ensuring that people with communication disabilities can fully participate in and benefit from health services and programs just like anybody else. It means being intentional about offering patients the communication resources and supports that they need, planning ahead, and making sure information is shared in formats that are accessible for everybody. Um, and in the end, we hope that there's better health and safety outcomes. So why is this important? I think we touched on this a little, and you probably know why too, but I started thinking about the why. Sometimes people, it's like, oh, this is nice to know, but is it really need to know? And I think these whys are kind of need to knows. So I think it's important because when we remove barriers to communication, we all benefit, not just people with communication disabilities or their care partners, but everyone involved in care. So if you look at some of these things on the slide, I think if we can bust the barriers, those access barriers, it really helps us all. Effective communication access reduces frustration, right? Patient and provider frustration. It can reduce adverse events. It can reduce healthcare costs. Oops, sorry, went forward for a second. Um, and it can aid in faster diagnosis, more accurate diagnosis. I think it improves trust and safety we talked about. And I think patients can better follow their treatment recommendations, or they might follow up with you more consistently, and be able to give informed consent and make decisions. And I think we hope that ASHA's Communication Access Initiative is a positive step forward toward achieving some of these outcomes that you see on the slide and reducing disparities that we know exist and just improving quality care. So I think we all want these things in common. And that's why I think this is important. So now on to our access framework. At the center of our initiative, and you may have seen on the pretty colored handouts or PDF, the photos of the PDFs I had a couple of slides ago. The center of our initiative is ASHA's Access Framework. And the framework really just consists of 6 core principles to make communication in any form. So whether that's spoken communication, written, something visual, pictorial, electronic, more inclusive across the healthcare journey. I mention electronic because electronic health records or being on the phone and going through like press one now, those things they're challenging for me sometimes. They're extremely challenging for the patients that I work with. So these 6 core principles, we're hoping to support more inclusive communication any place along the healthcare journey. And these are available, like you may have seen in the other slide, in Spanish as well. And I think to make the principles easier, it's 6, it's in no particular order. But we shape them into the acronym ACCESS because we're talking about access, and we know that healthcare providers tend to like and use acronyms a lot, or at least they're used to them. And we field tested this ACCESS acronym both with people who have communication disabilities and healthcare professionals. I think it's also very important to note that everything we've did with this initiative, we included our end user audiences, and that wasn't just providers in the end, it was also our patients, the people with communication disabilities, because we wanted their voice to be heard in this. And again, it's just not a step-by-step instructions that need to be followed in a particular order. It just happened to spell out the word access. So what I like is that many of the strategies that you'll see when we go through, they cost little or nothing to use. They can be implemented right away once you know what to do. And and I think some of them are intuitive, and I think they can improve experiences for everyone. So I want to take a little bit of time to walk through each of the six principles together. The A is going to take the longest, and you'll see why in a minute. Um, and hopefully, again, if you walk away thinking about one thing you can do from one of these principles, I will be thrilled. So many people with communication disabilities, like I had shared, are fully, we don't always know their competence may be masked by their communication disability, but many of them are fully capable of sharing and understanding health information and making their own healthcare decisions. Some aren't, but many are. So as long as the information is presented clearly and they have the right supports in place. And that's why, to me, the A in the access framework is so critical. So I am glad it's first, even there's not necessarily a particular order, but I do think this is kind of a key first piece. I think it's essential to ask about their communication preferences, strategies, and accommodations, ideally before care begins. I know that's not always something that can be done, especially in emergencies, but or at least at the very start of care. So in an outpatient setting, this would be great to be able to do this before care begins, or at least at the very start. We want to find out how the person prefers to give and receive information, what strategies work best for them, and what supports or accommodations they might need. And I've included some examples of this on the slide here of how to open that conversation. I think sometimes I've had providers say to me, well, I don't know if I'm comfortable asking that, or am I going to offend them? And the suggestions on the slide here of how to open the conversation, these come from what people with communication disabilities shared with me. Again, I ask my patients, kind of what they want. And so they said you can ask things like, do you have any communication support needs? Ask me how do you communicate best? What helps you? That's a really simple one. What helps you communicate? Do you require any accommodations or services? I think we're seeing that question asked more and more routinely. Or what communication tools or supports do you need? Those are just some really simple things you can say at the beginning. And the message that my patients have shared with me and wanted you to know is that they would much rather you ask than assume or not say anything at all. So it does not offend them to ask this. So let's take a closer look. Again, under the A, I want to take some time to take a closer look at about some of the supports that we want to ask about, because the A was to ask about preferences, supports, and accommodations. And I think it's important to, again, remember every person communicates differently. There's not a one size fits all. So one of the most, I think, valuable things you can do is to find out what specific strategies best support a person in their conversation, because we all have a conversation, and it might not always be through verbal or voice means, but we try to have conversations with our patients. So some of these things you may already use. You see, these are supported conversation strategies. And you might use some of these things like speaking in clear, simple language or using teach back to confirm understanding. But there's other supported conversation strategies that you might not be as familiar with, like some people benefit from using larger, bolder print, or if you have things in writing, highlighting what the keywords are, or writing down keywords, breaking down information into smaller chunks, giving choices. Do you want A or do you want B? Even for meals, or restating ideas in a different way if they don't seem to be understanding it the first time. If you repeat it in the same exact way, chances are they might not get it that time. So you might want to think of a different way to say the same thing. And then some of my patients do better with gestures and facial expressions or writing, but then there's others that prefer to avoid writing entirely, but they can draw. Like you think about all the different ways we communicate. It doesn't just need to be by spoken language. Some patients might do well with photographs or videos. And others, if you have charts or like body diagrams to point to, or even real objects they can touch, that can help them a lot in their understanding, or even expression that they can show and point to something on a model. I think For patients experiencing new or sudden communication difficulties, they might not have these strategies identified and in place yet. So that's where they can benefit greatly from working with a speech language pathologist to identify the conversational supports that work best with them. So that's just a little bit about some things you can do with conversational strategies that, again, you can see some of these things are little to no cost. But another important area to ask about under the A, you saw the word accommodations, and I've said it a few different times. Again, ideally in advance or as early in the interaction as possible, you want to know what accommodations they need. Um, and accommodations are something that the Americans with Disability Act refers to, and they are accommodations essentially are adjustments to items or procedures in your setting or systems that you have that enable a person with a communication disability to engage as fully as possible. But they can also be things like, again, simple things, but changes to the environment or policy or a process that helps the person increase their understanding or participation in the medical exchange. So they don't, again, communication accommodations, they don't need to be elaborate or complicated or expensive. Some of them are, but they do need to just make communication clear and effective to support full inclusion. Again, that's the goal under the ADA. So some of the examples that you see that I have here on the slide, we've all talked about time. And I think one of the greatest accommodations that my patients benefit from is extended appointment times and or appointment times at specific times of day. Some of them don't get started really well in the morning and they need a later time in the day and their communication would be better. Others, it's the complete opposite. They start and they're really strong in the morning. Sometimes some of my patients who have more progressive neurological diseases, their communication may deteriorate more at the end of the day. So just thinking about that's an accommodation, thinking about when you're seeing the person. Sometimes you might need to modify where they are, like sitting in a waiting area, if they get overstimulated a lot or if they can't hear as well, or if there's too much light uh, or or noise, or using sign language interpreters and captioning and relay services. Those are all examples of accommodations as well that you might be more familiar with. And then there's lots of assistive technologies that I'm going to talk about next. So finally, this is the last thing under the A, and then I promise we will move on to the C. You want to ask or know at least about any assistive technologies that a patient uses. These are devices or equipment that can help people with disabilities communicate and participate more fully in healthcare and other life activities. And I specifically want to talk about augmentative and alternative communication, which is one type of assistive technology, or AAC, as I will refer to it because it's a mouthful. And in my profession, we always call it AAC, and you might be familiar with that too. But AAC is one type of technology specifically used by people with speech, language, hearing, or cognitive difficulties to communicate, either temporarily or sometimes long term. Again, in the case of somebody with ALS, or maybe someone who has aphasia after a stroke, or someone with autism. Um, and audiologists and speech language pathologists were the professionals that can definitely help you and your patients acquire and use AAC or hearing assistive technologies. There's some hearing assistive technologies listed on this slide that my audiology colleagues are great to consult about. And any of us in the professions, we can also just help you assemble basic communication toolkits to keep at your settings or on your units until we can get there to help identify more individualized supports. So again, as you can see on the slide, some of these things can be low tech, like whiteboards and markers or just pen and paper, and some are high tech, like computerized speech generating devices, cochlear implants. Um, there's a lot of accessibility features on phones and tablets now, talking prescription bottles. So those are all examples of assistive technology and AAC. And the other thing I want to emphasize is that some people may have their own AAC or assistive devices. A lot of them will if they have more chronic disabilities, which they rely on as their primary means of communication. And it's really essential to incorporate those tools in your care whenever possible to ensure access and avoid communication breakdowns. So if they have an AAC device that they use all the time at home, or a hearing aid, or their glasses even, have that hopefully in the setting in which they're in. That's going to really open up access and create a more comfortable exchange for everybody. So finally, now we're moving on to the first C, and these next few we'll go quickly through the next ones. Um, I want to move on to the first C in access, and that's communicate directly. And this means engaging directly with the person who has a communication disability in your natural tone of voice, not shouting at them, rather than defaulting to their care partner, their support person, or even the interpreter. We often see, at least I see with my patients who are deaf, or I was a sign language interpreter, where the provider will talk to me as the interpreter instead of the patient directly. And really, we kind of need to be in the background as interpreters. The patient is, it's between you and the patient. Um, so some patients, that said, some patients may choose to have someone help them communicate or make decisions, and that's okay. But I think it's just important to clarify what everyone's role is at the outset. Um, I think because that kind of respect and just the presumption again of competence on their part, it goes a long way towards supporting their health and really your own rapport with the patient. So that's it for the C. I said it would be quick. The first C. The second C in the framework is to confirm understanding of information given and received. So again, it goes both ways. It's not just about making sure that the person understands the information you provide. It's equally important to confirm that you truly understand what they are trying to communicate to you. So if you're not sure what someone means, it's okay to say so. Like, don't pretend to understand and move on. Instead, maybe ask follow-up questions in a different way, like I said, or use gestures, use more visual supports, use pictures, or invite them to explain it in another way. So, can you tell me that again, maybe in a different way? Um, and the goal is really to work through those communication breakdowns together, so we all feel like comfortable in conversation and we feel comfortable saying when something's not clear rather than risking a misunderstanding by just kind of pretending you understand, and then that can really affect care and safety. The E in access, the lone E, stands for eliminate environmental distractions and give your full attention. So we want to start by thinking about the physical environment you're in and what might make communication harder. So things like noise, lighting that's too bright for some people, or too dim, strong smells, temperature, or a space that just feels busy and overstimulating. A lot of people with cognitive or developmental difficulties struggle with things that are overstimulating or certain smells and sounds. And these factors can significantly affect a person's ability to process information and respond to you and just engage. So I think it's just important it's also just important for you to think about how you're showing up in that interaction yourself. Are you fully present? We're often multitasking, right? As providers, we have a lot to do. We might be typing on a tablet or a computer, and is your back turned while you're talking to the patient? For someone who's deaf or hard of hearing or who has difficulty processing information, they often need to see your face clearly to understand you. So just taking that time to kind of turn away from the computer when you're chatting with them, even though you might be charting. Similarly, I think going over forms or sensitive information in loud spaces or even filling out intake forms in waiting rooms, that's hard for a lot of my patients, especially if they need help like processing and reading and writing. So if whenever possible, if there's a quieter or more private setting for that, for those tasks or conversations, that's another helpful accommodation. And then we have the first S in access. That stands for slow down. Give people enough time to process information and respond. And as we've discussed, time is a barrier. So accessible communication, like I said, takes time. It takes patience, particularly when someone uses a lot of different communication methods, when there's interpreter, when there's captioning that has to catch up, or even for you when you're using communication technologies that you're unfamiliar with. So time is important, but slowing down might be necessary, requiring more time. So again, allowing for longer visits, and just encouraging people to bring a list of questions ahead of time and prepare as much as possible. So again, important accommodation, I think, is time. And then the final S in access stands for support. People with communication disabilities often use more than one method to communicate, so it's important, it's rare that my patients just use one way. So it's important to support interaction with a mix of these strategies, tools, and services. Um, and and recognize that you might need to pair gestures with pictures, with videos, with their speech generating device. And again, many of these principles that I talk about are cost little or nothing to implement, and they can be put into practice right away. So what I have here on this slide is I want to ask you to think about how you might embed the access framework or a few of the strategies we talked about into standard practice across different healthcare communication touch points. So we're not just talking about that direct patient care one-on-one, but think about some of the things that we talked about. Where there's other forms of communication across the healthcare journey. So things like from looking at your signage, your scheduling to check-in forms, um, telehealth, that's challenging. What kind of access supports need to be given there? And I think, again, it doesn't have to always be complicated, but just asking those key questions at the start of the interaction or in these situations can, if you think about communication access in these scenarios, it will make your job easier and I think more effective too. So you may be thinking, wow, um, you're giving me a lot of information, Adina. This is a lot to take in. And where or how do we even start? And where can I find support? And the good news is you don't have to do this alone. We'd love for you and your team or your health system to collaborate with us. We are here to support our nursing and our healthcare colleagues, whether it's working with ASHA as an organization. We do a lot of work with other related professional organizations and healthcare systems. Or if it's with connecting with our audiology and speech language pathology members that work in your area or in your own settings, or partnering with people who have communication disabilities who bring great real life experience to this effort. So um, collaboration is key. Like I said, we wanted to look at this through the lens of interprofessional education and practice. I promised I'd share a few more of our communication access resources. We have our initiative has a free, publicly accessible web page and an online resource hub, and it brings together much of what I've shared today, along with a quick reference, downloadable PDF, those photos you saw at the beginning, the colored ones with the access framework and the patient and provider on it. Those are free to download in English and Spanish. There's a lot of just-in-time communication aids, so examples of communication boards that you can download and use, health and emergency planning tools. There's training materials in the hub and implementation guides for systems level work. And you can find everything at the link on this slide. And I think Monica can maybe put it in the chat as well for you all. And this hub, just so you know, it's a lot of things that are already out there. These are not all ASHA created things. We curated it again with the help of a variety of healthcare providers, other speech language pathologists and audiologists, and patients with communication disabilities. And what we're doing now is evaluating the hub because we didn't want to reinvent the wheel. There's so many great things out there. And so we just kind of wanted to curate it and bring it in one space. And we're looking through the hub now for resource gaps, and we're working with patients and providers to identify what still needs to be created. So after you've had a chance to explore, if you see something missing or you're like, I wish they had X, Y, or Z, or if you have a tool that you'd like to see developed, please let us know and I'll give you a way at the end to contact me. That being said, there is a new communication access animated training video that we did create that's on the web page, and it walks you through the six access principles in like the ones that I just went over, but in a more kind of animated way and gives examples. And I think it's a great resource to incorporate into things like onboarding or clinical education or any training that you might organize in collaboration with audiologists and speech language pathologists. And again, it's free of charge. It's there to use on the website. It's a brief training video. It's maybe 4 minutes, not even 4 minutes long. Um, Again, we know time is a commodity. Um, but I wanted to share some of the other ways that we can support you in interprofessional collaboration, how audiologists and SLPs can work together, what it might actually look like in practice, and how we can partner with you in your own settings to make sure you have the tools you need. So again, we recognize that most healthcare professionals, nurses, physicians, even occupational therapists, physical therapists, those outside of our field receive little training on disabilities in general and even less on communication disabilities. So you can partner with us to improve your own communication access skills or help modify the systems that seem to create unnecessary barriers. So we will work with you to train nursing teams on communication disabilities more in depth than I did today, on supportive strategies, on how and when to request accommodations or speech language pathology and audiology consults. We can model how to share complex information into plainer language, offer alternative formats for your patients with disabilities, to help develop inclusive health and safety materials. What are some of the other things we can kind of try to help to embed communication supports and assistive technologies directly into your standard workflows or your units or your spaces, your workspaces, and just advocate alongside of you for policies and environmental changes. Budget is a big thing that build a culture of communication accessibility. But it's not just you all that we want to work with, it's our patients too. We have an important role with in our individual patient encounters when it comes to communication access. So one of the best things you can do is refer patients to us early and often. And I just want to emphasize, especially for people that work in inpatient settings, our scope extends well beyond swallowing as speech language pathologists. I know in many settings, we tend to be referred to most often for swallowing issues in healthcare settings, but we can also ensure that patients have the systems and supports in place to communicate effectively at every point along the healthcare continuum, even if they're in the ICU, even if they're on the vent, especially if they're on the vent, and to empower them to self-advocate for what they need when it comes to accessibility and health and safety. So we teach our patients new skills and strategies to make communication easier for themselves and their partners. We help them set up and use AAC systems. We help them practice communication strategies. We might trial a speaking valve with them if they're on the vent, or provide other assistive technologies for them to use. And then we also try to support them in their own self-advocacy. We want patients to be able to ask for and use the supports and accommodations they need so that you don't always have to ask. Maybe if they come to you first, that would be great. So we help them develop communication access plans to share in their medical records or prepare checklists for their visits, or help them understand vocabulary, medical vocabulary, or practice questions to ask their health care providers. So we have a pretty big scope of practice, and I would just say don't hesitate to reach out to an audiologist or SLP in your health setting or area. And if you're not sure where to contact one, or find one, you can contact ASHA, and I'll share ways that, again, that we can do that at the end of the presentation. So before we close, I just wanted to highlight one resource from ASHA's Communication Access Hub specifically, because I think it shows what interprofessional education and collaborative practice between nursing and speech language pathology can look like in action. It is a very setting specific or unit specific, but it's just one example. There's lots of other. There's things happening in nursing schools, pre-service education, where people with communication disabilities are coming in and acting as standardized patients, and simulations are going on, which is great. But this program called Speaks To, it's a research-based online training program, and it's specifically designed to equip nurses in the ICU with the skills, strategies, and tools to communicate effectively for patients who can't speak. Obviously, typically due to intubation, artificial airways, tracheostomies, or if they have some type of altered cognition, delirium. The program is just made up of it's some self-learning modules that guide nurses online in selecting the right AAC strategies. But because you don't always need an SLP, and so there's an algorithm that this program has. It's like sometimes you might be able to do it yourself if you have the tools, but also knowing when to consult an SLP or an audiologist. And then part of the program is it includes some low and high tech AAC materials that get housed in a communication cart in the ICU. And then there's guides to know how to use them. And then there's weekly speech language pathology led case conferences that focus on current patients, real patients that are in the ICU, and how to develop individualized communication plans for them that have been developed collaboratively between staff and nursing. So I think nurses who've completed this training really have some positive things to say about it. Their patient provider exchanges have definitely improved. They report better pain management, and it's just reduced frustration overall for everybody. So I think it's just a great example to show how we can collaborate together, all in the name of effective communication. So to wrap up, here's my call to action. Be a communication access champion. Um, any of these, one or all of the things on the slide, ask people directly about their needs. That's huge. That was, like I said, my first and foremost, but reflect on your own interactions, build relationships, reach out to us as audiologists, SLPs, other disability organizations, patients, and spread the word. And advocate, for budget and staffing and flexibility if needed. I know that's hard. It's easy to preach that from here, but share what works and ideas that you have with others. I think again, as you leave today, I encourage you if you can just identify one step you can take toward advancing communication access. That would be great. It might be as simple as adding a communication access question to your intake form, or sharing the access framework with a colleague, or just one thing from the access framework that you learned. Or it might be as ambitious as like proposing a new policy for AAC as part of standard workflow, or setting up a training program. I think just each step we take creates a ripple. And the more we support effective communication in healthcare, the better the outcomes are for everybody, not just our patients, but for us as providers and systems. So um, just quickly, if you decide to plan to do any trainings, or you simply want to spread the word, these are the examples of the free downloadable PDFs again. And we also have, those are on the website, but also if you contact me, we have badge buddies with the acronym that I've shared at nursing conferences and physicians conferences. People can just have them as a reminder on their badges. We have posters, again, all available in English and Spanish, and you're welcome to contact me directly about these materials. And here is how you can get in touch with me and my audiology and speech language pathology colleagues at ASHA. And I also have some references at the end of the slide deck that you can learn more about the topics that we covered today. But again, please feel free to reach out anytime for support. And I guess with that, hopefully people can stay on for a little bit. I had a lot to cover, so I'm happy to take any questions that may have come into the Q&A, Monica.
Yeah, we do have a few questions.
Okay.
The first one is, would someone with an eye disorder such as macular degeneration fall into the category of communication disorders?
So the way that we define them at ASHA, not necessarily. They might, unless there's something else. I shouldn't say that. A visual difficulty is definitely a challenge with visual communication. It's not the kind that we treat within our scope of practice as speech language pathologists, but that could definitely impact their ability to read, to look at any kind of visual information that you're giving them, to if you're engaging in like doing a training in how to use a particular medical device or a medication, looking at medication bottles. So that definitely can be a barrier to accessing visual communication. It's not the type of challenge that falls within our scope of practice as speech language pathologists and audiologists. But that said, if there's tools that they have that help support their vision or can support their visual communication, then you know then then that needs to be considered. Like I said, is a form of communication. It's not the type that falls within our practice. What we do see sometimes visually in some of the patients who may have had strokes, they might, or some type of brain injury or brain tumor, is they can have a visual neglect, um, where they lose part of the vision and in their eye because of the neurological impact, and then, or they're just seeing portions, and then so what you're presenting to them maybe on a piece of paper is not all of what they're seeing. They may not get all of your instructions, or they might, some people have double vision. And so those things all impact. Yes, vision definitely is a form of communication. It's just not one that falls within our scope as that we consider our speech language voice cognitive disabilities, but there are vision specialists that work with visual disabilities or low vision. Great question.
Okay, another question is, has there been any efforts to create SPEACS-2 for general medical surgical units and clinics?
So that's a great question to ask, like to see where it's going. This is a program that was developed by Dr. Mary Beth Happ out of the Ohio State University. She's got a whole website about it and a ton of research on it, some of which I've cited in the references. And that would be a great question to reach out to Mary Beth to ask. I think what we've seen is we've taken some of those ideas and trainings, and they've gone into other settings. Like I said, I think the access principles that we've talked about, or the trainings that you can do with SLPs and nurses, can happen in any setting. I think she specifically was an ICU nurse. It's a very specific set of patients, and that's the research that she did. But there's certainly those things that are applicable to other. And there's things like at NYU Langone in the city. They have some great communication accessibility programs going on outside of just their ICU, with tablets at bedsides for all patients.
Okay, that was our last question, and also
Okay,
we are at time.
we are at time. Okay, so I'm just gonna forward through. So thank you again so much for joining me. These are the references that you'll have available to you in your slide deck, and I'm going to turn it back over to Monica.
All right, well, thank you so much for presenting your expertise for us today. We'll be more than happy to hear you again in the future. So we hope that you enjoyed this webinar. Um, I am posting right now a link to the evaluation in the chat. I just need to spell correctly. There we go. And I will stay on for a few minutes just to make sure that the link and everything else works for everyone. I also saw quite a few questions about the webinar that we had earlier this week, I believe it's Tuesday, and about having some issues getting your certificate for that one. So I am really, really sorry. We had an error happen with that particular one, first time it's happened, and hopefully the last. But for some reason, it just was not generating certificates for the people that completed that particular evaluation the day of, so on the 24th. It was fixed on the 25th. So if you completed it on the 24th, my suggestion would be to go back in to the course. There should be a re-enroll button. So click that. Unfortunately, you will have to do the course again, but it should only take you about a minute, and then it should process your certificate, and that should be then available to you. If you do that and that is not the case, please let us know at education@sigmanursing.org, and we'll look into the reason why it might not be working for you. Okay. Well, so I'm not seeing any problems in the chat right now. I'm gonna wait just for a few more seconds, and if nobody seems to be having an issue with the link and getting your certificate, then we can close the webinar in a minute. I'm very glad to see from people that it is working. And suggest? Um, okay, so Kimberly, that is how this works for our learning management system. It is technically a course. Um, the only thing that you will have to do is answer a question that you indeed watched the webinar and then complete the evaluation. Should take you more than a couple minutes. Um, if you are getting something like a bad request or if the link is not working, one thing that I would suggest is trying another web browser, specifically something like Chrome or Firefox. Also, this course is available via the catalog in the learning management system, which is just sigmalearning.org. So if the link isn't working, then you should also be able to enroll and take the course via the catalog. And yes, this link will load for if you're a member or a non-member. The only thing that you need to have is a free account with us. Okay, well, everything seems to be working for most people. Again, education at sigmanursing.org. If you have any questions or difficulties, the slide deck and the webinar recording will be available via the Sigma repository within a few business days, and you should get an email when that is available. I hope everybody really enjoyed this webinar. I hope you have a great day, and we'll see you next time.